Hey, pet parents. So I had a pet parent contact me and want to know what to give her dog with IVDD. And I couldn't answer the question without more information, and she didn't understand that. IVDD, intervertebral disc disease, is not just a give this supplement kind of a problem. And honestly, that's why I couldn't answer this pretty rude, condescending pet parent that contacted me, asking me to tell her just what to do for her dog with IVDD through Instagram messages. IVDD, intervertebral disc disease, is complicated. It causes back pain, neck pain, nerve pain, weakness, and sometimes even paralysis in dogs and other animals, including humans. In conventional medicine, IVDD is considered a degenerative condition where the discs between the vertebrae begin to dry out, degenerate, collapse. The disc bulges or even prolapses into the spinal cord. And that pressure on the spinal cord and nerves creates the pain, the inflammation, the weakness, and the neurological symptoms. We also know that these discs are very similar to ligamentous tissue, so ligaments. So holistically, we'll treat with supplements that we would use for ligament problems because the discs are very similar to ligaments. And because there's very little circulation to those discs, they can become brittle over time. So, from a holistic and a Chinese medicine perspective, there are many different reasons why that degeneration may be happening. Conventional medicine doesn't have the why, they just know there's degeneration and they treat it with steroids or non-steroidal anti-inflammatories, muscle relaxers, and pain medications like gabapentin. Muscle relaxers like methocarbamol, and pain medication like gabapentin. But in Chinese medicine, the degeneration will happen because of things like yin deficiency, where the body lacks moisture and cooling, or from excess heat, which dries out the tissues. It can occur because of poor circulation. It can occur because of coldness or stagnation. It can occur because of too much dampness in the body, which is like lumps and bumps and excess weight and stiffness combined with inflammation. It can happen with chronic weakness in the spine and the joints. So holistically, we don't treat every IVDD case the same way. Every pet is different. So that's the one huge difference between conventional medicine and holistic medicine. Conventional medicine uses one standardized approach: steroids, non-steroidal anti-inflammatories, muscle relaxers like methocarbamol, pain medications like gabapentin, tramadol, buprenorphine, and then strict cage rest, like strict rest for 6 weeks. That's all they do. And if it's bad, they go to surgery. Gabapentin is the popular pain medication right now, and honestly, it doesn't work that great. So, holistic medicine is different. We treat the pattern that the dog presents with, and not all IVDD cases look the same. Some dogs are hot, some dogs are cold, some are deficient, some are excessive, some need circulation to the spine and the discs and the vertebrae. Some need more anti-inflammatory support, like an ice pack, a not a not a not a real ice pack, but a treatment with herbs and supplements that act like an ice pack or anti-inflammatory. Some have dampness, some have stagnation, which is another word for things just not moving, which is also another word for pain. Some have acute inflammation and some have chronic degeneration. So it depends on all kinds of different um, variations of what can happen with IVDD in the body. And the protocol changes with every different situation. For example, if I have a IVD case with a dog that's acute, that just happened, with a lot of heat, severe muscle pain, inflammation, and a pulse that's very superficial. If I feel the pulse on the inside of the back leg and it's sitting on the surface, I might use a formula like Uplurum and Kudzu, or another cooling anti-inflammatory formula, depending on the pattern. If the same situation is happening, but the pulse is very deep and stuck and tight, and it's more like a Xiaoyang disharmony, I'll use something for like Xiao Chai Hutong. And I'll even use the Xiao Chai Hutong in a lot of the post-surgical cases. So when a dog goes to surgery for IVDD, a lot of times I'm using the anti-inflammatory formula like Xiao Chai Hutong, because it's a lot of times they have a deep, tight pulse at that point. With some of the acute cases that are very painful, there's a super strong formula called double P2 that I'll use in some cases. It is so potent, it will cause drug tests to be positive. Now, when a dog moves into the more chronic stages, they may still be weak in the hind end, they may still be inflamed, they may still have a deep pulse or a lavender tongue, and they may still need anti-inflammatory support. So I may still use the Xiao Chai Hutong. But if I find that they've kind of switched over and they need more circulation to the spine and the discs and the vertebrae, then I'll use a different formula that brings circulation into the area and warms up the area of the disc and the back and the spine. And a formula like that would be something like Duho Jishin Tong. So that's a nice one for the chronic IVDD cases, but not all of them. So we treat IVDD very specifically, and we have different protocols for all the different variations, and every dog will have a different pattern. So you have to match the right herbal formula to the right pattern that the dog has. I'll also use nutraceuticals and glandular support. So something like standard processed Neuroplex, which is a whole food supplement and glandular product that helps with inflamed nerves, because you'll always have nerve roots that are inflamed from being impinged by the disc prolapse or the disc bulging. And then I'll also use something like Ligaplex 2, which is also a standard process product. And these are both human products, so I have to dose them appropriately for the dogs. But Ligaplex 2 supports ligaments, but the disc is very similar to ligament, where it doesn't have a lot of circulation and it's very fibrous. So it supports the integrity of the disc and it helps it be more spongy again instead of brittle. So that's a nice supplement to use long-term with these guys. So the supplements that we use and the herbs that we use improve the circulation, improve tissue quality, instead of just masking pain. So we do a whole lot more than just stop the pain with drugs, stop the, relax the muscles with drugs, um, and do anti-inflammatories. Because honestly, some dogs don't need anti-inflammatories. They need more circulation. And holistic medicine can do that, but conventional medicine cannot do that. They can only do the anti-inflammatories. That's all they have. All right, so then there's physical therapy. So this is another area where holistic medicine differs from conventional medicine. In the acute, severe, painful cases of dogs with IVDD, especially pre-op and post-op, we avoid exercise. We avoid aggressive exercises. But you can still use gentle therapies, and that's still important because your dog still needs to have some kind of movement or circulation moving in the body. So things like massage or acupressure or laser therapy or red light therapy or pulse electromagnetic therapy. There's all kinds of physical therapies you can do for a dog with IVDD to help with the pain, the inflammation, the circulation issues, and relax them. And when we help them relax, that also helps with pain. So all these modalities help with eliminating pain. So we improve the circulation, we reduce inflammation, and that supports healing. And when we manage pain effectively, dogs heal better. Everyone heals better when you manage pain effectively. And as the dog improved, we can use more controlled movement. And that becomes important because movement helps resolve pain. Pain is, in Chinese medicine, pain is stagnation or a blockage of energy. And when we move, we're releasing that blockage, which releases the pain. So one thing that conventional medicine recommends that holistic medicine doesn't, conventional medicine recommends strict cage rest for 6 weeks or longer on these dogs with IVDD, even the mild painful ones. And that can be counterproductive because when you restrict or cage rest a dog for that long, you end up with muscle atrophy, you end up with stiffness, poor circulation, delayed recovery, chronic pain windup. So there's a lot of things that can happen when you restrict activity for that long. And honestly, holistically and from a rehab standpoint, prolonged immobilization can create these additional problems. So that doesn't mean dogs should go run laps at the dog park. They do need to have rest initially, but appropriate movement matters. The body is designed to move. So we use things like acupuncture for IVDD. We'll use cold laser therapy. We'll use massage, the PEMF, which comes in mats that they can lay on or loops that you can put over a painful area. We use chiropractic, but there are some caveats here because we don't adjust a hot disc, meaning an acute disc prolapse. We don't adjust the back of a dog with a disc prolapse, an early one, because that can definitely worsen the condition or even contribute to paralysis. But we do adjust other areas of the body, pelvis, hips, limbs, and other joints, because when the spine hurts, the whole body compensates. So if we adjust the rest of the body, that can help the spine, even though we're not adjusting that. So once the dog stabilizes and inflammation calms down, we can use gentle spinal work when appropriate. And so veterinary chiropractors are trained to know when that's appropriate. And we use very gentle manipulation techniques. We don't use anything rough with dogs, even ones without IVDD. They are not rough um, adjustments. They are very gentle. So I have to determine the stage of IVDD the dog is in. Is it just stage one where it's pain only? Is it a more advanced stage where there's weakness or paresis and loss of coordination? Is it maybe paralysis where you've got loss of neurologic function? Because those stages can dramatically change the treatment um, decisions and the prognosis. So hopefully this explains why there's not one simple answer for IVDD, like this lovely lady asked me, and was very upset with me when I couldn't answer her. But I just can't ethically look at a text message and say, oh, just give this herb or just do this therapy. I need to evaluate the stage, the pain pattern, the dog's constitution, where the inflammation is. Is it inflammation, or do they need more circulation? Is the dog hot? Is the dog cold? Is the dog deficient and old, or excess and young? What's the neurological status? How's the mobility? Is it an acute problem? Is it more chronic? And so, or somewhere in the middle. So every dog is different. And good integrative medicine or holistic medicine is individualized medicine. Every dog is going to be different. So that's IVDD on a holistic level. And I really wanted to have this lady that asked me this question about IVDD to jump on a Zoom call with me so I could ask her all this stuff and figure out where her dog was. And so I could recommend certain herbs and supplements and physical therapies based on what she told me. And maybe if the dog got on the Zoom, we could look at the dog too. So that's all I wanted to do, is jump on a Zoom and help her, but she didn't want to do that. But if you want to do that, I have pet health strategy sessions. Let me get the QR code. All right, that's the QR code for my pet health strategy session. And just scan the QR code and it'll take you to my strategy session, where you could schedule a 30-minute Zoom with me, and we'll troubleshoot what's going on with your dog and figure it out. We'll figure out where your dog is, with IVDD or whatever illness or condition your dog has, and figure out the best next steps and maybe some herbs and supplements that you can use. If you've got a dog with more complex problems, or a cat that you've got medical records, you're unsure what to do, maybe you want a second opinion. I do more complicated cases with my telehealth consults, where I go through the records. I have you fill out intake forms, and we get on a Zoom for that. And I figure out a specific action plan for your dog. And that's the telehealth consultation. So I'll pop that up here. So that's more detailed, and I get more information. It's not just talking back and forth on a Zoom and troubleshooting. It's actually going through all your pet's medical records, all your pet's lab work. I look at x-rays, I look at ultrasounds, I look at MRIs and CT scans. I figure out all the things that are going on, what's been missed, what we can do on a holistic level, maybe what's what hasn't been done on a conventional medicine level that could maybe help. So I give you a lot of information. All right. So I just wanted to talk about IVDD because that little text conversation kind of bothered me. And everyone should know that it's more complicated than what herb can I give my dog with IVDD. You just can't answer that. There's no way to answer that thoughtfully and professionally. And there's just no way to give someone medical advice without knowing more. Okay, so I'm done with my rant. And I'll talk to you later. Maybe I'll have another question that maybe is a little nicer for me.